Preventing infection. The risk of infection from a peripheral nerve block is low but may be increased with the use of indwelling catheters. Infection rate is decreased by the use of steroid technique and benefits of performing the block should be reassessed in the setting of bacteremia or overlying skin infection. Minimizing the neurological injury. A meta-analysis of 32 studies over a 10-year period found 3% rate of any neurological event after peripheral nerve blocks. Interscalene is more than axillary, that is more than femoral nerve blocks, and only one case of permanent neuropathy. There have been no randomized clinical studies that clearly demonstrate nerve stimulation or ultrasound-guided peripheral nerve blocks to have lower complication rates compared to transarterial or paresthesia techniques. However, many practitioners believe that direct visualization under ultrasound may minimize the needle to nerve trauma, as motor response may not be elicited even if the needle is intraneural. Other possible factors that may lead to increased neurological injury are the injection of local anesthetics after paresthesia, resuscitation, and injection of local anesthetics under high pressure or resistance. Detecting the systemic toxicity. Toxicity from local anesthetics primarily affect the central nervous system and the cardiovascular system. CNS toxicity symptoms progress from oral numbness, dizziness, and visual disturbances to seizures and coma. If allowed to evolve unimpeded, local anesthetic systemic toxicity may progress to cardiovascular toxicity, manifested as an arrhythmia or a complete cardiovascular collapse. Most cases of systemic toxicity have been attributed to inadvertent intravascular injection of local anesthetic. The maximum dose of specific local anesthetic with and without epinephrine are discussed separately. Minimizing the risk of bleeding. Unlike the risk of anticoagulation in neuraxial blocks, the risk of vascular injury for peripheral nerve blocks in anticoagulated patients is not well defined. While the placement of nerve blocks is severely coagulopathic patients should be avoided. Peripheral nerve blocks are generally considered relatively safe compared to neuraxial blocks. Hematomas may be more common with the use of continuous catheters than with single injection techniques due to the large gauge catheter introducing needle. Thank you. Come to the end of my discourse. The next part will come in the next video. Thank you.